Alright, let's dive into something that might just change the way we think about dental care, especially for kids. Here's the deal, scientists have found a way to stop cavities without the dreaded drill. Yes, you heard that right. No drilling, no injections, no sedation. Just a simple liquid called silver diamine fluoride, or SDF. Sounds almost too good to be true, right? But here's the kicker, it's been used successfully in other countries for decades. So, why are we just hearing about it now? That's what makes this really interesting. Personally, I think this is a game changer, especially when you consider the stats. Tooth decay is the most common chronic disease among kids in the US, affecting over 40% of them. That's staggering. And untreated cavities? They're not just painful, they can lead to infections, sleep issues, missed school days, and even surgery under general anesthesia. It's a huge problem, and traditional treatments aren't always accessible or practical, especially for young kids or those with dental anxiety. So, when I heard about SDF, my first thought was, why isn't this already a thing everywhere? Here's how it works, dentists apply this liquid directly to the cavity with a sponge-tipped applicator. It takes seconds. No drilling, no trauma. And the results? A recent Phase 3 clinical trial led by the University of Michigan found that SDF stopped decay in more than half of the affected baby teeth when applied every 6 months. That's huge. But here's the catch, it turns the decayed part of the tooth dark. Permanently. Now, I get it, a black tooth might not sound appealing. But if you take a step back and think about it, isn't that a small price to pay to avoid pain, infection, and surgery? What many people don't realize is that baby teeth are temporary anyway. They fall out eventually. So, if SDF can stop the decay and prevent further issues, that's a win in my book. What this really suggests is that we've been overcomplicating dental care for years. I mean, why hasn't this been widely adopted in the US sooner? The answer lies in the need for rigorous clinical trials to prove its safety and effectiveness here. And that's exactly what this study did. It provided the evidence needed for potential FDA approval, which could make SDF a standard treatment. But it raises a deeper question, how many other simple, effective solutions are out there that we're not using because of regulatory hurdles or lack of awareness? From my perspective, SDF isn't just a treatment, it's a bridge. For kids, it could buy time until their baby teeth fall out naturally. For adults, it could be a long-term solution or a temporary fix until they can afford more extensive care. And for populations with limited access to dental care, like those in rural areas or with disabilities, it could be life-changing. One thing that immediately stands out is its versatility. It's not just for kids, it's for anyone who needs a simpler, less invasive option. But let's not overlook the broader implications. If SDF becomes widely adopted, it could reduce the number of emergency room visits for dental pain, lower healthcare costs, and improve quality of life for millions. That's not just a dental innovation, it's a public health breakthrough. Personally, I'm excited to see how this plays out. Will dentists embrace it? Will insurance companies cover it? And most importantly, will it become the go-to solution for cavities? Only time will tell. So, here's my closing thought, innovation doesn't always have to be high-tech or complicated. Sometimes, the simplest solutions are the most revolutionary. SDF is a perfect example of that. It's not flashy, but it works. And in a world where dental care is often inaccessible or intimidating, that's exactly what we need. What do you think? Would you opt for a black tooth if it meant avoiding the drill? Let me know in the comments, I'm curious to hear your take.